The Silent Killer: Unraveling the Mystery of Lung Cancer in Asian American Women. Imagine walking down a bustling street in San Francisco's Chinatown. The air is filled with the aroma of dim sum and the chatter of Cantonese. Among the crowd, you spot a group of women laughing and chatting. They look healthy, vibrant, and full of life, but appearances can be deceiving. Meet Vicky, a 53-year-old mother of two. 5 years ago, her world turned upside down with a single phone call. I remember vividly, Vicky recalls, her eyes distant. He called me while we were out having dinner, left a voicemail. That voicemail led Vicky to an oncologist's office where she heard the words no one ever wants to hear: "You have cancer." But this wasn't just any cancer. Vicky, who had never smoked a day in her life, was diagnosed with stage 4 lung cancer. Vicky's story is not unique. In fact, it's becoming alarmingly common among Asian American women. Dr. Scarlett Gomez, a professor at the University of California, San Francisco, has been studying this phenomenon for years. Lung cancer rates have been declining over the past several decades, Dr. Gomez explains, but what emerged as an unusual observation is that the exception to that trend was among Asian American females. This observation led Dr. Gomez and her colleague, Dr. Iona Cheng, to launch a groundbreaking study called FANS, Female Asian Never Smokers. For 15 years, they've been digging into why lung cancer rates are rising among Asian females who have never smoked. Their findings are startling. Among Chinese women diagnosed with lung cancer, nearly 80% have never smoked. Compare that to just 14% among Native Hawaiian and Pacific Islander women, or 21% among non-Hispanic white women. But why? What's causing this silent epidemic among Asian American women? To answer this question, we need to zoom out and look at the bigger picture. The Asian American and Pacific Islander community is incredibly diverse, comprising people from over 50 different countries who speak more than 100 languages and dialects. This diversity makes studying health trends challenging but also crucial. Dr. Bryant Lin, co-director of the Center for Asian Health Research and Education at Stanford, emphasizes the importance of understanding these nuances. We can't treat Asian Americans as a monolithic group, he says. The health disparities within this community are significant and often overlooked. One of these disparities is the funding gap. Currently, only 1% of funding from the National Institute of Health goes to diseases that impact the Asian American community. This lack of resources makes the work of researchers like Dr. Gomez and Dr. Cheng even more critical. Their FANS study is taking a multi-pronged approach, looking at genetics, family history, environmental factors, and lifestyle exposures. They're also examining the role of neighborhoods, considering factors like air pollution, traffic density, and the proportion of recent immigrants in the area. But research is just one part of the equation. The other part is awareness and early detection. This is where Vicky's story takes an inspiring turn. Instead of letting her diagnosis defeat her, she's turned her pain into purpose. She now leads walks with other Asian American women battling lung cancer, creating a support network that extends beyond hospital walls. One of these women is Kid Ho, a 34-year-old mother who was diagnosed on Thanksgiving last year. Doctors discovered 4 tumors in her brain, believed to be linked to lung cancer. Like Vicky, Kid had never smoked. "It's like a safety blanket for me," Kid says of the walking group, to know other people are in the area going through the same thing. These walks are more than just exercise. They're a lifeline, a way for these women to share their experiences, fears, and hopes. They discuss the latest treatments, compare side effects, and offer each other emotional support that only those who've walked in their shoes can provide. But the impact of this disease goes beyond the patients themselves. Vicky's daughters were just 13 and 15 when she was first diagnosed. The fear and uncertainty they've had to live with is something no child should have to experience. "I don't want to leave them," Vicky says, her voice breaking. "I want to see them graduate, get married, have kids of their own." This desire to see her children grow up fuels Vicky's determination to fight. It also drives her to participate in the FANS study, hoping that her experience might help researchers find answers that could save future generations. The FANS study is not just about collecting data. It's about giving voice to a community that has been often overlooked in medical research. It's about recognizing that health disparities exist, not just between racial groups, but within them as well. Dr. Heather Wakely, chief of the Division of Oncology at Stanford, is another key player in this fight. She's working on developing more targeted treatments and screening methods for Asian American women. We need to rethink our approach to lung cancer screening, Dr. Wakely explains. The current guidelines are based on smoking history, which clearly doesn't work for this population. Indeed, the current U.S. Preventive Services Task Force guidelines recommend lung cancer screening for adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke, or who have quit within the past 15 years. But what about women like Vicky and Kid, who have never smoked? This is where the importance of the FANS study becomes clear. By understanding the unique risk factors for lung cancer in Asian American women, researchers hope to develop new screening guidelines that could catch the disease earlier, when it's more treatable. But developing new guidelines is just the first step. Implementing them and ensuring they reach the communities that need them most is another challenge entirely. This is where community outreach becomes crucial. Organizations like the Center for Asian Health Research and Education at Stanford are working to bridge the gap between research and community. They're hosting health talks, partnering with community organizations, and using social media to spread awareness. We need to meet people where they are, Dr. Lin says. That means translating our findings into multiple languages, partnering with trusted community leaders, and addressing cultural barriers to healthcare access. One of these cultural barriers is the stigma often associated with cancer in some Asian cultures. Many people believe that talking about cancer or getting screened for it can bring bad luck. Overcoming these beliefs requires sensitivity, patience, and culturally competent healthcare providers. Another challenge is the model minority myth, the perception that Asian Americans are universally successful and healthy. This stereotype can lead to the overlooking of real health issues within the community. We need to shatter this myth, Dr. Gomez asserts. It's preventing us from addressing very real health disparities. As researchers work to unravel the mystery of lung cancer in Asian American women, patients like Vicky and Kid continue their daily battles. They're not just fighting for their own lives, but for the lives of countless other women who might be at risk. Their stories remind us that behind every statistic is a human being, a mother, a daughter, a friend. They remind us of the urgency of this research and the need for increased funding and attention to health disparities. But their stories also offer hope. Hope that with continued research, improved screening, and increased awareness, we can turn the tide on this silent epidemic. As we wrap up our journey through this complex issue, let's return to that street in Chinatown. The next time you see a group of Asian women chatting and laughing, remember Vicky and Kid. Remember that health can be deceiving and that sometimes the biggest battles are fought silently. And most importantly, remember that each of us has a role to play in this fight. Whether it's participating in research studies, spreading awareness, or simply being there for someone in need, we all have the power to make a difference. As Vicky says, cancer has taught me that life can change in an instant, but it's also taught me the power of community, of research, and of hope. So let's carry that hope forward. Let's continue to ask questions, push for answers, and fight for the health of all communities. Because in the end, this isn't just about lung cancer in Asian American women. It's about creating a healthcare system that truly serves everyone, regardless of their race, ethnicity, or smoking status. The mystery of lung cancer in Asian American women may not be solved yet, but with each step forward in research, With each woman who shares her story, and with each person who becomes aware of this issue, we get a little closer to unraveling it. And who knows, the answers we find might not just help Asian American women. They might lead to breakthroughs that could benefit lung cancer patients of all backgrounds. So let's keep walking, keep talking, and keep fighting. Because in this battle against lung cancer, every step counts, every voice matters, and every life is worth saving. Thank you for joining us today as we explored the latest developments in cancer research and treatment. Remember, knowledge is power. Stay informed, stay hopeful, and don't hesitate to share this video with someone who might benefit. If you enjoyed this video, subscribe to our channel, hit the notification bell and like button, and watch our other videos. This will help us tremendously to grow the channel and continue to provide meaningful content. Together, we can make a difference.